open our Hard of Hearing Task Force meeting this morning. It's Friday, May 30th, and the time is 9:05, and we're happy to have you all with us. My name is Christy Abrams, and I'm the Hard of Hearing Specialist, and we're joining you from the Arizona Commission for the Deaf and the Hard of Hearing. A few important points I'd like to make is our meetings are accessible. We have ASL interpreters and communication access real-time translation, or CART captioning, which is created here in this meeting by a highly trained live person, which gives us the most accurate captions possible. And just a quick note too, for those of you who may be joining us via YouTube, I'd just like to say that CART gives hard of hearing people access in various settings, and oftentimes people aren't aware of that, but medical appointments, courtrooms, classrooms, workshops, seminars, churches, entertainment venues, and beyond. So hard of hearing people are protected under the Americans with Disabilities Act, or the ADA, and it gives us the right to request accommodations such as CART. And it really is the gold standard and the best kept secret. But without further ado, I'd like to introduce each of our Hard of Hearing Task Force members that are joining us today. And I'm going to go ahead and do a roll call. And then Task Force members, if you could please acknowledge that you're here just by raising your hand and saying here after I call your name. And then also, once you do that, you're welcome to mute your microphone and also turn your camera off. And then when we're done with that, we'll get started with our further agenda items. Okay. All right, Roz Siebold.
Here.
Thank you, Roz. Great to see you.
Thanks.
Ron Tolman. Great, Ron is here. Raise his hand is here. Liz Booth.
Here.
Thank you, Liz. Good morning. Great to have you here. And Fred Williams, Commissioner Fred Williams.
Here.
Good morning, Fred. Thank you for being with us. Okay, great. We've done our roll call, and we're happy you're here. And I'll go ahead and let everyone mute your microphone, please, and I'll have you turn your camera off. And the reason we do this is so that everybody can have the best visual vantage point during this part of our meeting. All right, and so the next part of the meeting I had sent out and shared our minutes from our last session when we met in November. So I hope you had a chance to review those. And I just want to have an opportunity, if anyone has any comments or any revisions need to be made on our minutes from November, please let me know, or feel free to make a motion to approve as is. Good morning, Nikki. And if you would like to make a motion to, Liz, hi Liz.
I move that we accept the minutes as printed.
Okay, thank you, Liz. Would anybody like to second that motion? And thank you, Fred, for the second motion. I appreciate that. Okay, we have a motion to approve and a second by Fred. Appreciate that. Okay, and next on our agenda, I would like to introduce Nikki Sukup, our Interim Executive Director, and she is going to be sharing some information regarding public policy and community relations reports. So Nikki, welcome.
Good morning. Good morning, everyone. Thank you, Christy. All right.
I was trying to turn on my microphone earlier. Can you hear me okay? Okay, great. Good morning, everyone. As for the public policy report, what most important right now regarding with our state is that we have what passed was a bill that the Speech and Hearing Association has been working on for the past few years, and it's the Audiology Compact. And it's specifically the SB 1075 Audiology and Speech Language Interstate Compact. And this means that audiologists and speech language pathologists are able to work across state lines. So we are able to do telehealth, we are able to work within the state. So it's really exciting that, and in the past, the issues were, to keep the health in Arizona. And so it's good to have this pact. This was sponsored by Senator Soap. And then what we are also working on in terms of the state is the support service provider program for the deafblind. And I have been working closely with the legislator, and we have received confirmation that this was on the discussion topic with the legislator and under the other fund bill. And so we are hoping for additional funding. We have since had limited funding with the support service provider program that serves deaf-blind and individuals who have combined vision and hearing loss. As for other issues within the state public policy, those are the primary issues that we are focused on. There was a big, I'm trying to think of the right word, a big challenge with the developmental disability uh, funding with the Department of Economic Security. And they will receive the funding to continue through this year with the governor's support. And they're hopeful that there won't be any additional funding issues through the rest of this year. What we're also watching is, of course, the close of the state legislative session, and that will likely happen in June. And then there's also the federal policies that we are watching, and the Medicaid bill that many are concerned about. I attended a press briefing, a briefing with Senator Kelly, and he was saying that what's important is that we continue to share our voice with our legislators and let them know what we think, call them, email them, and share our thoughts with our legislators on any of the federal policies, especially with the bill that's currently being discussed in Congress right now. So we are watching, and there is a group of us, including the governor, that have expressed concern about this current bill. It has passed the House, and it is currently in the Senate. And so we will make sure that we keep you all informed if there are any impacts regarding this bill. It will not impact the commission directly, but naturally it will impact the community that we work with, are part of, and serve. And so I will ensure that you are all informed throughout the process. I'd like to turn this over to Lena Banerjee, and she will talk more about community relations.
This is Rena. Thank you so much, Nikki. This is Rena here, and it's great to see everyone today. Happy Friday. I just wanted to share some updates that we've been working on. Well, really, I've been working on specifically. It's something through ACDHH. It's a community group. It's a consortium. And that is starting to have meetings online. So we have community leaders that come together to collaborate and discuss different key issues and workshops, services that would be a benefit for our deaf, hard of hearing, and deafblind community and the people that we work with moving forward. During the last meeting, we had a discussion about the smoke alarm installations, and we partnered with Arizona Burn Foundation, ABF. And we went around and installed smoke alarms in many different locations. And there was one place that was in Prescott Valley. And we also had a walk, and there was over 400 accessible smoke alarms that had already been installed statewide. So that is something that we will continue doing and installing those. It had a great impact, and really the install for the deaf and hard of hearing community here in the state of Arizona. So we're currently trying to work on searching for funding for Tucson. We wanted to expand the program to that area. And what's interesting, if you have a smoke alarm in your home or you don't, you are absolutely welcome to reach out to the Arizona Burn Foundation. If you're interested in promotion for workshops, conferences, or any kind of event, and that's coming up, you can speak to us directly, or you can send Ann Smith an email, and we can submit an event on the website for ACDHH. Go ahead and feel free to send us whatever you have as far as promotions and events. And we'll make sure to have those events ready for you to sign up soon. You'll see ACDHH at 2 conferences that are coming up soon. The first is the African American Conference on Disabilities and AACD, and then WEAD, that's the World Elder Abuse Awareness Conference. So stop by our booth and talk with us and connect. And then just recently we hosted an event, and it was at the Heard Museum. And we did that in partnership with ATHD. We had over 40 attendees that came. People were engaged. They really enjoyed things. They got to visit, see the different art, hang out with our team. And then also we provided American Sign Language interpreters and CART throughout the entire event and process. And then we also got feedback and heard. We're always looking for a way to plan to improve accessibility at the museum. So that is something that we have done and set up. Okay, so I think that's all. And if you guys have any questions, please feel free to reach out to me. Thank you so much.
Had to turn on my microphone. All good? Thank you, Nikki and Rena. Appreciate all of that great information. All right, we're going to go to the next agenda item. And what I do, one of the parts of what I do for the Hard of Hearing Task Force meeting in preparation of putting the meeting together, I always ask our task force members to give us agenda items. And so several of our task force members shared that they really wanted some information regarding our executive director search, or maybe to have some discussion about that, and having thoughts about the process, the progress, and any impact that that's had on the agency, on ACDHH. So I would just like to open it up, and if anybody, what questions you may have, or if anyone has any comments on that, that's our next item on the agenda. So feel free to open up your camera and your microphone and ask any questions regarding that. Hi, Roz.
Where do we stand with that? Or where does the board stand with that in this search?
All right, that's our first question. And I know we'll do your question first, Roz. All right. And who would be the best one to give feedback for Roz on that?
And I also wanted to know how this interim situation is affecting the commission itself.
Okay. Hi, Liz.
Hi. And to add to that, I know it's a long process, a long story, but could we have a very succinct timeline of how we got to this point from the beginning? You know, we had a good year when Sherry Collins announced she was going to be retiring. How did we get to this point? Why are we here yet?
Okay, great. Thank you, Roz and Liz. And so I'm going to put that information back. And who would like to, executive team and managers, or what would be the best way for us to move forward with sharing information on that? Thank you, Mickey.
Good morning. Thank you, Roz and Liz, for expressing your concern, which is completely understandable considering the timeline that we've had. I will share first. I have to inform everyone that because I am also interested in the role of executive director, I need to be transparent about this and that I don't want there to be any perceived conflict of interest because I am interested in this role. And I am going to leave that there. What I will tell you is what has happened in the public meetings since. That is information for everybody to know. The last time the task force met was in November. And since that time, there was the Board of Commissioners that had met. And I understand that both Roz and Liz were former commissioners as well. The Board of Commissioners had determined that the previous search, they were not at a level where they were comfortable to continue with, and had voted to redo the search. And that happened in November. Yes, Sherry Collins had mentioned her retirement back in, I believe it was May of that year. And there was a search process that ensued nationwide. At this point, since November, the board had voted me to continue as interim executive director. And how this has had impacted the commission, to be frank, yes, I think naturally in any situation, in any corporation, and any organization that goes through an interim process will have periods of uncertainty. And I continue to work towards ensuring that the executive team works together and that the entire agency works together to continue the great services that we provide to our community. and that will not suit. Where we are now in the process is that the search will continue with a new committee that was recently formed as of the previous board meeting. And they have selected representatives from the hard of hearing, representative, deaf, blind, combined vision, hearing loss, deaf, interpreters, and parents. Our chair is part of this committee, and its chair, Commissioner Cinco, is part of this committee as a non-voting member of this group because the board had agreed to keep it to an odd number. And so with the hard of hearing representative is Commissioner Belmoxit. With the deaf blind representative is Andrew Cohen. With the deaf representative is Commissioner Diana Huron. With the interpreter representative, it is Commissioner Swenson. With the parent representative, it is Commissioner Kidd. And so with the five, they are called a search committee, and they will decide what the process looks like going forward. If you have any questions, wanting to know more about the upcoming executive search process, you can reach out to Commissioner Chair Cinco directly. And we can provide you with her contact information if you don't have that already. So I hope that provides a summary of where we are in this process.
Christy, may I go ahead?
Yes, Liz, please.
Yes, thank you, Nikki. That was a good update. I just have a couple of questions, though. Let's go back. Go back after Sherry's announcement, etc. The first go around, we did have, I believe, 3 candidates apply for the position. And I am just wondering, 2 of them continued with their applications. And these candidates were well versed in our commission. And by the way, we all know our commission has an excellent national reputation. And we've always been very proud of that. So thank you for that, commissioners. But these applicants were well informed, knowledgeable, experienced, etc. And you mentioned that the board at that point, once the applicants were eventually allowed to present their cases, you said that the board was not satisfied with the level of the search. What did you mean by that?
When the search began, and I know that we have our Attorney General, Assistant Attorney General here, and I'd like her to chime in as well at this point before I continue.
Hi, my name is Elise Phelan. I'm the Assistant Attorney General who represents the Commission. And I do just want to first say that regarding this item on the agenda, it's to discuss the process, progress, and agency impact. Just want to clarify that going over the history might be stepping a little bit past that, and we've had some issues with overstepping and getting off track with the agenda. So I just want to be really clear about the extent of the agenda, especially because, just so you know, all of this took place on the public record, and the commission may be able to answer those questions at a future meeting, or maybe a more specific agenda item be included at the next meeting for this task force. But the process, the progress, and the agency impact going forward, I believe, are what's on the actual agenda. So I just want to ensure that the open meeting laws are completely intact at this meeting. So
Thank you, Elise. Yes, and Ron, I'll let you go ahead.
All right, thank you. Just a short question. We understand the process right now, and I deeply appreciate everyone chiming in. Do we have a timeline that we're looking at? When is the next vote?
Thank you, Ron. This is Nikki. Sorry, I gotta undo my microphone.
Thank you, Anne. The search committee is meeting this come Monday, and they will decide what the process looks like. And as soon as what the board has determined, we will communicate that with everyone throughout the nation. And we will keep you informed as to what the search committee has decided. The timeline, I understand, is we all want to get moving and move forward with this process so that we have a executive director, the next executive director in place.
Thank you.
Thank you.
Ron, did you have something more? And then Roz, did you have, I didn't want to go forward. You had your camera on. Did you have another question, Roz?
I just wanted clarity that we're not going to discuss what happened when the search started because it's not appropriate now. That confused me. I mean, if we can't discuss it now, when can it be discussed? The next meeting will be, a moot point.
sure. So it's not that it's not appropriate in and of itself, it's that it's not on the agenda.
I thought it was.
And the progress, process, and agency impact are. And also, admittedly, the history is very long and relatively, not necessarily complicated, but some of the questions regarding what issues they had, what certain things, a lot of that took place in executive session, which is privileged and private. So the general timeline is on the public record, but a lot of the more specific questions and things that the commission determined are privileged and confidential based on those executive sessions. And since this agenda isn't very specific about discussing sort of the whole backstory and the history and, to what extent, I don't think it's inappropriate, like conceptually, but as far as what's on this agenda, I just think that this is probably going a little beyond that.
If it's just to understand, we're not privy to that information, even if it was on the agenda?
Not necessarily. It would depend on what the things you wanted to know. I would want to clarify in advance that anything that gets asked or said isn't in terms of that, especially because there is a commissioner here who may have more information and those lines. So if there was going to be a layout of the history, I think that, again, not only is it not on the agenda, it also, would be something I'd want to look at in advance and make sure that nothing privileged accidentally gets said if really specific questions start getting asked.
Thank you.
Of course.
Yes, Liz? Thank you,
Yes.
Roz. Liz?
You told us about the 5 members of the search committee. Now, is it appropriate to ask about their hearing status? Deaf, hard of hearing, related?
Yes, I suppose that's part of the process. I don't have my full notes from the last meeting regarding that kind of information. So Nikki might know, but that also might not be, an off the top of our head availability, but I'll defer to Nikki on that one.
Sure, give me a moment.
So thank you, Liz, for asking. And thank you, Elise, for your comments as well. So for the 5 members, we have Commissioner Bonmarket, who is hard of hearing. We have Andrew Cohen, Commissioner Cohen, who is deaf-blind. We have Commissioner Diana Huron, who is deaf. We have Commissioner Swenson, who is hearing. And then we have Commissioner Kidd, who is deaf. So those are the 5. That is what they identify as and who they represent. And again, with Commissioner Kidd, he is the parent representative of a child who is deaf, hard of hearing, or deaf-blind. So while his hearing status is deaf, he also represents the children that we serve. And so I think what's most important is that we ensure they ensured that there were a variety of representatives from the commission. What I also understand, if I may add, is while as they discussed the process going forward, they will also discuss how input can be included from the staff, from the other community members throughout this process. That's my understanding from what was discussed during the previous board meeting.
Yes, Liz?
Okay, and again, tell me if I'm going beyond the propriety of our discussion today. But by my count, that is 3 deaf people, 1 hard of hearing, and 1 parent. Now, it seems a little top-heavy to me with deaf representatives, since all of these representatives are representing our community in the state of Arizona, with 1.3 million hard of hearing people and 20-some thousand deaf people. It just doesn't sit right to me somehow. I'm just throwing that out, and at least maybe I'm above and beyond what we can talk about today for him.
That's part of the process and the progress, so you can certainly bring that up, but this isn't, because this isn't a meeting of the board members, no action can be taken. So if that's an issue that you have with the group or the way that it's been set, you can certainly, I think, it may be that sort of issue since no action can be taken here and that was decision made by the board. You could, I think that might be best addressed as a public comment at the board meeting rather than something here, since this is just an update, and since this task force is not in a position to take any action against what the board has already done, but it can be brought up to the board as can anything as a public comment.
Thank you.
Of course. You're welcome.
Thank you, Liz. Thank you, Elise. Does anybody else have, regarding our agenda item, which was number 4, any other comments or thoughts before we move on to the next agenda item? Okay. All right, that takes us to agenda. Oh, yes, Elise. Oh.
Sorry, that was an accident. I'm playing with my computer.
I do want to add, please feel welcome to contact Commissioner Senko, the Chair Senko. She is aware of the discussion happening today, and she wants everyone to know that they can contact her with questions about the current process, and she'll be happy to meet or talk or respond to each of you.
Thank you, Nikki. May I ask, what would be the best way? Would that be a direct email, or is that something that we could put in chat or share with the task force members? Or I can, if you give it to me, I can share it with the task force members.
I will
muted,
add
Nikki.
her email to the chat.
Okay, great, perfect. I'll be sure to share that with everyone in case you have any additional thoughts or questions for her. All right, thank you, everyone. All right, moving on to agenda item number 5. I'm really excited to introduce our brand new assistive technology specialist who has been with us for 20 years. Vicki, you can turn your camera on. We're so happy to have you with us here today. And as you all know, this very familiar, hopeful face, Vicki, we're so lucky to have. I know you've been here with us 20 years, is that right? That's
yes,
a big,
plus.
I can imagine all of the people that you have assisted and helped, and I'm so lucky to have you as my teammate. And I'm going to let you say hello, and then whenever you are ready, Vicki has a really great, about a 15-minute slideshow for us. So do you want to just take a minute and say hi, Vicki?
Hi there. I am Vicki Thompson. I am the, like we say, the brand new title of the Assistive Technology Specialist. And I've been doing a lot of the assistive technology for so many years, but the climate really is shifting that way. So we've got actual communications for the telephone specifically, but so many things have broadened over the years that we as a team are consistently learning, and so many things come to us. Don't be afraid to contact us, and say 99% of the time we can find a solution that will at least make movement towards whatever problem or challenge is going on. So we're so glad to help and work as a team and get creative. So Christy, if you want to go ahead.
I'll go ahead and let me take a moment here to share my screen, and I will, let's see here. Just 1 second. How is that looking? Is that okay with everyone? Everyone can see that clearly? Okay. I'm going to mute my microphone and my video, and I'll let you take it away, Vicki. Thank you.
Yeah, no worries. So yeah, I'm here to really, hate to say, but push the contacting /me/us as the commission, especially the task force members, because I know that we have been engaged for so many years, yet there is equipment. We're talking hard equipment, which I will go through, that you can be our advocates, you can be our intermediaries to the public, showing what we have to offer and how great our staff are. So let's go on down here. Next slide, Christy. All right, that's me. I told you my story. I'll tell you a little bit more about my story. Originally, I'm from Nebraska, and I was working at a pizza place. Yep. And this was when TTY relay was really the thing, and I got a call from through relay service. I did not know what it was at the time, but when the man made his order, he came in to pick it up. I realized he was deaf, and granted, we have a lot of crossover population, but that was my first experience working with deaf folks, and then of course hard of hearing folks. And I have a heart for service. It's what I do best. And I was just clinched on to serving people. And that means people with speech challenges as well, combined vision and hearing loss. That's what I do. And I love it. So the big heart, that's me. So go ahead, Christy. And like I started to say, is we've got these different classes of people that we serve. And with me, I really, for most people, because it is so wide, really get to know a lot of our clients, really one-on-one. So there's a lot of firsthand service, and that's really what I truly love. And most of the time I get a true fit, where there's just not a lot of people who come back saying, this doesn't work for me. It's because I dig personally into what their needs are, and serve them on multiple levels in multiple different ways. So everybody you see here, that's what I do. Go ahead, Christy. All right. Just like I was saying, with the Arizona telecommunications equipment distribution program, and of course now with the assistive technology program, very much crossover, it's allowing people to have change in their life, like it says. And I, being the support of a lot of people, their family, their friends, this is where they're acknowledging the challenges that they have, and we help them make the changes that is going to improve their quality of life. Christy? All right, so we're going to start out with amplified telephone calls. With so many people, they need a bit of amplification. I get a lot of folks who where my voice, I do have a lower register of voice. I'm not a soprano by any stretch of the imagination. And so many people say, if other people would talk like you, I wouldn't be hard of hearing. It's because I enunciate, I put a bit of space between my words. I'm very clear on the lips. I look at people, of course, that's by 20 plus years of doing what I do. And so we've got to do a lot of those types of coaching and clarity about communication. And that applies to telephone calls, because of course I'm on the phone a lot. Let me show you what a few things are that I have. Christy, next slide. We are coming into the smartphone age and have been for quite a while. So just let me show you a few of the things that I have. Now, granted, there are people, it's basically a split on if people wear hearing aids or cochlear implants, or if they don't have them. There's a variety of things to dig into with that. We have a couple of different, I can show you here, see myself. We have a couple of different Bluetooth amplified products. This one is more, hate to say simplistic, but easily operational. This has a cord. This fits a lot of people. And when Christy consults, or when I consult with folks, we go over the different products and we make a fit on, what, this might be the best. Or we've got another one. This is a Bluetooth device as well, and amplification. This one does have an app where you can control it on your phone, and you can customize those sounds to the best of your ability versus volume up, volume down, maybe tone control. It has more customizable types of settings. And again, these are free. Everybody loves free. And we have a handful of those. We also have the Bellman Be Here device. Oh, here we go. And this one has the television part in it. Don't look at that. We don't provide that as of yet. You never know. But this one, it has those, again, the Bluetooth with the earbuds. You'll see that. And again, those are for folks who don't have hearing aids, or I also say for those folks who may misplace their hearing aids for various reasons, or lose them, or want to have a backup. There's a variety of individual things to consider when choosing to apply at all, or to apply for what device. Christy, next slide. All right. Now we do have models we've had on the program for quite some time. This first one, and this is just a little sampling. I do not have each device. That's what our online application packet is for, or I can mail you one or email it, whatever the case may be. This one is the Panasonic device. A lot of people like this one. It's got the caller ID, answering machine inside. I think of my parents, they would love this. My own father is considerably hard of hearing, so I do have very much firsthand experience with this. My husband is becoming hard of hearing. He would say I am too, but I don't know about that. We'll see. And then this one is still quite popular. This is the cordless phone. It does have caller ID on it. And these all go up to about 50 decibels of extra amplification. They all have the tone control. There's a variety of settings that can be adjusted to a person's needs. I did not bring the big one in the middle, but we do still have the kind that is attached to the base. We have a couple of those. Next slide, Christy. All right, so devices that signal an incoming call. Now, keep in mind that these products, granted, your cell phone that has some alerting devices. We'll get to that, but we do have some. A lot of folks do fine with the amplified ringing. We can make it very loud. We can make it with low tone. We can make it with higher tone. So a lot of people are satisfied with that, but there are folks who do not hear their phone ring for a variety of reasons. So I'm going to start out with this one is where you can set your smartphone on it. And then when it sets there, it'll feel the vibration and it will alert you to all of the other pieces that go with it. This is a pager. I encourage this for folks who are hard of hearing, deafblind, low vision. This, you can put it in your pocket or on your belt, and it will vibrate within, of course, the range. It is not Bluetooth, but it is wirelessly connected to the base that I just showed you. It also has a remote receiver where this is going to flash and ring. And then there is, with this particular bundle from the company, this is a bed vibrator. So where if they have it on their nightstand, it does plug in with a cord. but a lot of people need help with getting up in the morning. They don't hear their smartphone that's set. And, you know, there's a variety of things, again, that I consult with people on where we come to a conclusion of which way we need to go. And that's that. There's a lot of different kinds. So Christy, go on down. All right, so the Square Glow one, I do not have that here, but this is one that needs a plug-in. So that can be a video phone or an old-fashioned plug it into the wall landline as we speak. Go ahead. Christy, there we go. That was the one I just showed you here. Again, just like I got a little out of order. It's okay. So this was a great device for folks who have. Now this one we have to, again, consult a little bit sometimes because this can be used with a landline, hence the RJ11 jack there, just the old-fashioned plug-in kind, or it can be for cell phones. And that's, you know, it's all lined out in the catalog, the application packet, but, you know, I'm your gal to help it out. Next item, Christy. All right, so this one is only landline, and it is an alarm clock, so to speak, but it does have double jacks in here for old-fashioned, so to speak, telephones. So, and it has like the doorbell device. Again, those come as a package. We are a telecommunications program, so I'll get to that with the application requirements. Next slide. All right, this is one of the new devices that we have added, and I think a lot of folks, deaf or hard of hearing, would enjoy this. They just have to know about it. And so you guys all over YouTube, think about it. Go online, get an application packet. This one, I don't know if you can tell it, but it has a little pole. And what it will do is that it's Bluetooth connected to your smartphone or your iPad, your smart device. So however you set up those notifications is how this will come in. Now, granted, this does not have any kind of flasher. There's no visual attention. But you can, however you use it, might be on your body, might be under your pillow, you know, whatever your life looks like is how we figure these things out. But again, we have things to offer, so spread the word. Next device, Christy. There we go. So now, granted, I did not bring everything here today, but this will bait the hook on what we do have to offer, maybe other questions you want to ask. But if you do find something within the Arizona Telecommunications Equipment Distribution Program or the phone program, if you do find something in that realm that you do want to apply for free, these are what is required. There is an application form, just fill it out, and then I can help you with model choice. That's not a problem. Or if you see it, write it down. Next thing is professional signature. So a professional, and there are 8 different categories of that. Might be your audiologist or your doctor or a rehab counselor. There are those categories where they do have to sign it, saying this person is one of those 4 categories. And so then there are the different proofs. So the model, let's go through here. The application, there is a conditions of acceptance form. You do have to prove citizenship and fill out the form accordingly. There's proof of Arizona residency that is needed. Something of an official nature, proving the address that you wrote on the form. And then we do now require proof of the telephone service that you have. So if you have landline bill, and you have to choose a landline product, or if you have cell phone bill, you have to choose a cell phone compatible product. If you have both, you have ultimate flexibility. But that is what we require. And so go ahead and next slide, Christy. So the process, it's really quite easy, and I'm the one who guides you all the way through. So you'll find out about us. Like I said, you'll complete the forms, get some guidance, which most folks need, submit it to me. I will answer all your questions. Then I will print a voucher. It's on thicker cardstock type yellow paper, and I will mail the voucher to you along with instructions, which are to sign it and mail it to a vendor, which is listed there. They will pull it off the shelf, ship it to you. You open up the box, charge it up or plug it in, connect it, whatever the case may be, and you're going to enjoy it. Your life is going to improve. It's going to be fabulous. So, and if you have any questions, you can contact me or the manufacturer, whatever the case may be, and we'll be glad to help you out. So, next slide. Caption telephone options. I may be going a little longer here. Now, we at the state here do not offer any kind of physical telephone that is captioned any longer. That ended of December last year. However, there are all sorts of options. And I'm just going to go through, Christy, next model. And we have to keep in mind that these are all free. You can Google caption telephone for the home, and there's, I think, 4 or 5 models, just like you see here, that will come up, and those brands will have their own application process, and those are seen on their own individual websites. But if you do not want a desktop type phone and you want it mobile on your cell, there's plenty of free options there as well. Next slide, Christy. So, like I said, you can research these. They're all the same concept. There is one here on the far right that does do speech, but again, read through the website or contact me. I'm glad to help. But the beautiful thing is that oftentimes people will pair like their own Bluetooth hearing aids or a Bluetooth device that we provide to them, and they can hear as good as they can, which it has a variety of levels, and then they can see on their phone that captioning, which is pretty good. Not perfect, but pretty good. So I oftentimes encourage people to call me as their practice call, because I can guide folks over the hump. A lot of times people have mental barriers to change, and they have self-doubt, they have lack of confidence, and contact me. I know exactly how to help them. A little bit of counseling involved, a lot of encouragement, and we can make them successful users of this technology. It's a beautiful thing. Next slide. And this is just a little bit of a scene on the individuality. You can make the text bigger or change the font in different ways, just like most everything is customizable these days. Next slide. Oh, face-to-face captioning. We love this. Every time I demonstrate this, people's chins just drop, their eyes go open, and they think of a million ways this can be used. I love it. And so I have one downloaded on my phone and my iPad, if you can see that. I showed this one time at the HLAA meeting down in Sun Lakes. Wow, what a life changer. I hope you folks, wherever you are, I hope you're using that. But of course, we have smartphones in our pocket, a little more convenient. And so I have one here, and it's downloaded. There's no registration. Again, this is assistive technology that is free. So I encourage you. I'm going to just tap this right here. And as you can see, I'm going to try to see, there we go, that everything that I say is coming up on the screen. And I'm hoping that you can read this And this is exactly what I do, is oftentimes I'll put it on my cheek because I want the person to see the puzzlement in my eyebrows or the joy in my expression, or whatever my facial cues may say. I want them to see if it matches what those captions are showing. And this is life-changing with so many people. I've had them contact me back saying, we use that with Dad every time we go to his house. And it's free. Goodness, we just have to know about it. We just have to share it with one another. Turn that off there. And so, but you can do so many things with so many different apps. Next slide, Christy. All right. So I'm Vicki Thompson, and if you've got questions, please reach out to me. I'm always here for our public. And if you've got a question, we most likely can find an answer and apply to the program. Spread the word. We're here for you, and I hope you all have a great day. Christy, back to you.
How's that? It's quick. Thank you so much, Vicki. We are so fortunate, incredibly fortunate to have you. And I know you help so many people every single day, and you really are just one of a kind, and people gravitate towards you. It's just really easy to be motivated and inspired just by you being you and the way you share information. So thanks for that awesome presentation. And do we have any questions? Roz is eager and has a question waiting. Go ahead, Roz.
Hi, Vicki.
Hi, Roz.
I just want to publicly thank you for how easily accessible you are and were. I'm retired now, but when I was working as a hearing aid dispenser, I knew I could lift up the phone. I had a patient with me. You would be on the other end, and we could really expedite the process. And so thank you, thank you, thank you.
You're very welcome.
But my question is, how does the public, I would think that the majority of the deaf and hard of hearing people in the state don't even know about the commission, much less what you do. And is there a way that you can get in front of or get the ears or the eyes of the audiologists or the hearing aid dispensers in the state, that you can educate them to what you do? The only reason I knew it is because of my involvement with the commission.
Well, between all of us, we're trying to get the word out and have been for a very long time. We have outreach that we do. I personally reach out to so many things. I have my trackers that I do for various types of entities. And I aim at entities that perhaps work very much with a hard of hearing population, which is our big target, deaf, speech impaired. I've done so many different outreaches. I do follow up on these people saying, yep, still hear it. Hey, has it clicked yet? We're still here and it's free, and so how should I say, it's really on the motivation of that recipient of our information. I have some people that, boy, once it clicks, bam, 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 they are on me like every other week that they have another client, and how can we help them? And so I see it both ways, that people see it as another thing to do, which that's not the right framework. And then there's like, oh my gosh, like you say, the biggest heart ever, and they will go to help every person they meet. So I guess I'm trying to put the pebble in the pond out there, as particularly on this situation here today for YouTube and our task force, that we're still out there. We're still doing and providing this free of charge, and educating and training. I'm only one person. Of course, I've got the whole team, but we're trying to make impact everywhere we go. And and trying as as much as possible. But I so appreciate you and all of the like advertisement and advocacy that you have done over the years that has changed people's lives. But keep on the grind, I guess, is the simple answer. We're still doing what we've always done and trying to recruit helpers to educate.
You know, I forgot what it's called, but I should know, but the hearing aid dispensers in the state have a professional organization that meets once a year. Have you spoken there?
Well, there are a couple of different organizations, and the acronyms are scrambling in my brain right now. But I have spoken at a couple of the conferences
Oh,
over the
good.
years. Granted, that was a little while ago, but I do have some contacts still. I know that Michelle and Christy still are very close, personal relationships with some of those folks. And so it's not that we're a stranger to those folks. We're
Good.
not. But it's again baiting that hook of really having that realization of concrete, oh, I get it now. And where and it's easy. What I try to really emphasize with those professionals is that they just have to give the application packet. And or if you're the professional, sign part C of the application packet, give it back to them, and let them and their family take it over the line. So try to make it as simple as possible. I emphasize that with folks, because people see state government as cumbersome, and I just try to say, I'm your gal, bring it on, we'll make it simple. So because we have to, we just have to, because people feel overwhelmed the way it is. And I'm there to relieve that.
Oh, it couldn't be easier if they know about it.
Right. We're trying, Roz.
Thank you, Vicki.
You're very welcome. Thank you.
Thank you, Roz. Does anyone else have any other comments or questions for Vicki? All right, well, Vicki, this is now out there in YouTube land, so I certainly hope that people will find the information and be able to connect with you, because you're such an awesome resource. So thank you again. We appreciate you being here today. And what we're going to do next, I think this is probably a good time for us to take a 5-minute break. It's about 10:15. So I would go ahead. I think Ricky has a slide. And Ricky, if you don't have the break slide, I can pull it up. I don't know if you have, but we're going to go ahead. Let's see. It's 10:13. So let's come back. Let's come back at 10:20 just to make it
Hey, Chris,
right on the nose there. Yes, Ricky.
I do have the slide. I'll share, okay?
Okay, thank you. And I will see everyone back at 10:20. Thank you. There we go. Is my audio okay? Okay. Thank you for that, sharing that slide, Ricky. Welcome back, everyone. It's always good to have a break for our interpreters and for our CART provider. And with that said, we'll move on to our next agenda item. And that would be me, Hard of Hearing Specialist Report. So I just wanted to start off by saying May has been a big month for me. A couple of celebrations. Just celebrated my daughter Nora graduated from high school. So that's just been so many emotions and such a great time. And excited to see her go on to ASU this fall. So I'm celebrating that. And also May, I'm celebrating 1 year with my cochlear implants. So I can't believe it's been a year ago that I was implanted, and it's just been a year of discovery. There's no other way to say it. It's been a wonderful experience, really, but one that's been a lot of work for my brain, and I appreciate all of the support I've had from the hard of hearing community. And I've been connecting with so many other people that have cochlear implants or are thinking about it. And it really has been a great experience. But I wanted to share with everyone here regarding my report. First up, the annual Hearing Loss Association of America, HLAA, which is our national organization. The convention this year is in Indianapolis from June 11th through the 14th. And this really is a life-changing experience. If you have never attended, hopefully you can figure out when maybe a convention will come to a city near you. Last year we had it here in Phoenix, but this is an accessible event for people that are hard of hearing. It brings together hundreds of people with hearing loss around the United States, where people can learn and discover and connect. And it gives an opportunity to check out the latest technology and hear from various experts during a series of empowering events. And they're all designed to help us live our best life of hearing loss. So I'm really looking forward to this and hope to see some of you there. Also, one of the main parts of my position here at the Commission is to provide people with connection regarding our Hearing Healthcare Assistance Project. We call that HAP. We provide this in partnership with Northern Arizona University, Arizona State University, and the University of Arizona. So those three universities, we work with our speech and hearing clinics. And this project is for adults who have low income. And for those who qualify, we are able to send them on for a hearing test, and then hopefully they will maybe qualify for hearing aids. And not only that, because we know it's not only about hearing aids, but it's also so many other things when we're hard of hearing that help us to know about requesting accommodations, learning about communication strategies, how to self-advocate. So all of those things, it's all part of the project, not just getting a pair of hearing aids, but it really makes, we think, a positive impact, and it's an ongoing process for people to learn about all of those different parts of navigating life of hearing loss. We've referred more than, I'm working on the 120th referral, and hundreds of other people who have reached out, and they may receive referrals to different programs or just information and resources that will support them. I might send them to Vicki, and so they can tap into some of those awesome devices that she shared with you just now. So it's really busy, that part of my job there. Another thing that I love to do is I provide presentations with my colleagues, and we do this virtually or in person all across the state of Arizona. And our aim is to educate healthcare professionals, public safety, human service agencies, employers, entertainment venues, universities, schools, and beyond, you name it. Topics include, we talk about accommodations, communication access, assistive technology. We touch on emotional impact and all sorts of other important information and resources for people. And we hope to really make our presentations fit each individual audience and be able to bring them information and help to just really empower people and enlighten people who maybe have never even talked about hearing loss before. So we really want people to understand the importance of accessibility for not only hard of hearing, but the deaf and deafblind, and we want people to be able to have the best quality of life that they can have. So since November, there is a long list of presentations that I've done, and I don't want to maybe read the whole list, but just to kind of touch on some of the places that we've gone out to. And I know Roz had a great question for Vicki as far as how do we let people know who we are. And as part of our presentation, we always share information on all of our programs. So a little bit on what Vicki does in the assistive technology and the devices that she has. I talk about the hard of hearing community, about HLAA, and then often I present with Kim Menard, our deaf specialist, and she'll educate people on deaf culture and all sorts of things. So one of the presentations we did was with Phoenix Indian Medical Center. Then we went to Chandler Gilbert Community College. I think I saw a couple of you there. I made a drive down to Florence Gardens Mobile Home Association, and this is a community for retired seniors. And they have, being that it's a retirement community, more than 60% of people over the age of 60 are hard of hearing. So they reached out to me because many of their residents were having challenges understanding during their monthly community meetings and their board meetings. So they wanted to learn more about that. Another meeting that we participated in was really fun. We actually gave a presentation to the New Mexico Commission for the Deaf and Hard of Hearing just to get feedback, because we'd love to hear from other professionals. How are we doing? What do you think of not only the information we're sharing, but how we're sharing it? Is it clear? So we love getting that feedback from New Mexico, our sister state. And we've done that back and forth with them, and that was really, really helpful and great to have that feedback. I know that, let's see, Latrina and I, our family services specialist, we gave a presentation at Gilbert Public Schools. That was really fun. Another presentation that I did, I was invited to AT Still University to their audiology department. And this was great. They asked me to do 3 hours, and at first I was a little intimidated about being able to present for 3 hours, but we had the best conversation, and the audiology students were really eager to learn what next after hearing aids. So, and as you all know, it's so much more than hearing aids. What other resources are there? What other information might someone benefit from knowing? So 3 hours went by in a blink of an eye, and we had a great time together. And hopefully now they know about the commission, and they know that they can send people our way for resources and information. We presented to SAGE Counseling Services, another program that, again, when people are in human service agencies or receiving counseling, especially, if someone's deaf, they might get an interpreter, but a lot of times when people are hard of hearing, they don't know what to do. What do we do? They're not hearing well. They may have never heard of CART like we have here today, communication, access, real-time translation, captioning. It's just not something that's on their radar. They feel if I just speak louder, it'll be okay. And we all know that's not always the case. There's a lot of things that can go into helping people have communication, equal access, and effective communication. Another thing that I did is I went with Cameo down to the University of Arizona. We participated, let's see, Latrina also was there, our family services specialist, but we participated in mock jury selection at the U of A Law School, and that was fascinating. They have a beautiful room that's set up to look just like a real courtroom. And boy, that room was challenging because it was made of beautiful white glass. So the reverberation, as you all know, I would have not been able to do it had there not been a CART provider there. So the students that were in law school and also the professionals on the bench that were educating them had never heard of CART. So I was so excited to be there with CART. Latrina had ASL interpreters, and so we gave an accessible experience because there's no reason why we can't serve as a jury. We just need to have that access to communication. So that was a great experience. Kim and I went down to the Arizona Museum of Natural History. I learned that this is a sign for dinosaurs. So we talked with them about how to make tours more accessible, and we gave a presentation to teach them all about what ACDHH does. And again, just having the staff learn, and some of the staff, by the way, are hard of hearing too. So it was just a great conversation and presentation, and it just lets people know that we're here and all that we do. Another thing that I'm working on, we've been doing a 4-part caregiver support session in partnership with the Alzheimer's Association, the Southwest Alzheimer's Association. We had our first session in April. I'll let the interpreter switch over. Yeah. We had our first session in April, and our second session is coming up June 11th. We've been meeting for about for an hour and a half, 3 to 4:30 for each session. So we have one left in June and one in July. And this is where we support caregivers that might be hard of hearing or deaf, or maybe they're caring for someone that's hard of hearing or deaf. And we all know, as having been a caregiver myself, there's already a lot of emotions and stress involved. So we want to make sure that people have resources and information to have that communication and that access. And so those are some of the things that we talk about. And also, caregivers can learn a lot more about Alzheimer's and navigating as a caregiver. So it's been a really good partnership there. What else? Let's see. Oh, another fun thing I did, I went down to meet with Diamond Dogs. This is a group that trains service dogs to be hearing dogs. And so they wanted me to come and tell them a little bit about the commission and what we do. And I was there with all of the dogs and the trainers. And I'm going to put, maybe Michelle can put that link for you. But Diamond Dogs is a wonderful program. And if you have a dog yourself, wow, this is a great class to participate in. And it's a process of teaching the dogs to be able to alert you to your environment, to some of those sounds that you may not hear. I really enjoyed that. Yep, thanks, Michelle. I knew she would put that in the link for you. If you have any questions, you can tap into that link there and learn more about their program. And it would be, I believe they participated and presented in some of the HOH chapter meetings too. So I really enjoyed that. Let's see. Kim and I presented for the Native American Connections. We did a presentation there, and Ashley, our communication access specialist, was with us. So again, the whole team works together to provide all the different parts of what ACDHH does, so that we can educate the community. And I think people don't know about us. So that is our aim. We want people to know that we're here and to know the services that we provide. And we actually just, the day before yesterday, we had a Zoom presentation with the independent living for older folks that It's called ILOB, Independent Living Older Blind. And so we're really starting to partner with them. We're going to meet with them again and just learning how we can support older folks that may have combined vision and hearing loss. And that's a really something that we look forward to doing. And then today, right after this meeting, I'm going to meet up with Vicki and meet up with Kim and Victoria, and we're going to be presenting for Ability 360 this afternoon. So we have been really busy providing presentations, and that is how we're trying to get the word out. We want people to know about us. We want people to be familiar and comfortable and never hesitate to email us and connect with us. And we really do provide a lot of information and resources for folks so that they can, live the best that they can and navigate the best that they can. All right, let me see here. What else do I have? That just gives you a little snippet of what I've been doing. Does anybody have any questions as far as my role as a hard of hearing specialist and connecting with the community? Any thoughts, questions for me before we pass it off to Michelle? No? Okay. Well, I'm keeping busy, and I'm just privileged to be in this position and very passionate, and I'm going to let Michelle take it over from here.
Thank you so much, Christy, for that really extensive report. You can tell that Christy's very, very busy. So for those of you who may be watching online live or in the future, I want to introduce myself. I am Michelle Michaels, and I am the manager of the Hard of Hearing program for Hard of Hearing programs and services at ACDHH. And so what that means is that two members of my team, which you've seen today, Vicki Thompson, our absolutely wonderful phone lady, who's now our assistive technology specialist, and Christy Abrams, our hard of hearing specialist, are on my team. We all direct report to Carmen Greensmith, our deputy director. But I have been with the commission since 2007. But my career in deaf and hard of hearing services started in 1993. I started working for the Arizona Relay Service. And so I've been in the field for 32 years. And that was after a 12-year career in broadcasting. So first 12 years in broadcasting, and then have re-careered into this field for 32 years. I have a bilateral hearing loss. I am hard of hearing, like 1.3 million Arizonans. Christy and I are the two hard of hearing staff out of a staff of 21 at ACDHH, representing the hard of hearing community. And as you can tell, all three of us, Vicki and Christy and I, just love what we do. We love our community. And we're just so glad that you're here today with the task force. I wanted to mention that the task force actually started in 2007. And that was the year that I joined ACDHH. And that was the year that a very important bill was passed by our state legislature. We call it the telecoil bill. And what that bill did was it said anybody who dispenses a hearing aid in Arizona must inform the purchaser about telecoils and how they can help people. So telecoils are tiny little medical pieces inside of a hearing aid, and how that helps a person access loop systems, neck loops, room loops, countertop loops. And so it improves our communication. And that telecoil bill also required, to Roz's question earlier, also required hearing aid dispensers and audiologists to inform people about the Arizona Telecommunications Equipment Distribution Program, aka the free telephone program, which Vicki works in. And so that was a very important bill. And so we created the Hard of Hearing Task Force to start working on issues related to the hard of hearing community. And one of the first things that this task force did was create brochures, because again, we're talking 2007, right? So we're very paper-based back then. And we created brochures to educate consumers about telecoils and effective listening, as well as the professionals. So that was one of our first tasks that we did as a task force. So just a little bit of history there. But I am thrilled to join you today in 2025, managing this wonderful hard of hearing program. Really excited about the changes that are on the horizon for the hard of hearing program. Again, in my responsibility area, I manage Vicki Thompson, who is becoming our assistive technology specialist. So we're taking our free phone program and we're evolving that and morphing that to better meet the needs of consumers. And so very soon, in probably a month or so, maybe 6 weeks, you're going to get access to an online survey that will survey you, anybody who's deaf, hard of hearing, deaf blind, has combined vision and hearing loss, or is speech impaired. We want you to take this survey, or if you're a parent of a child who has one of those disabilities, please take the survey and let us know what types of assistive technology you need. Rena's on our call. She spoke earlier. She's a wonderful person in our community engagement unit. She and Vicki are working very closely on developing that survey. So that's coming up. But I'm really excited about the expansion of the phone program into assistive technology. Another thing that I'm really excited about is our Hearing Healthcare Assistance Project, which Christy mentioned. It has been going now for 4 years. So we started this in May of 2021. It was a long process preceding it. The Hearing Healthcare Assistance Project, in 4 years, Christy has assisted over 1,000 people who have reached out to our agency and asked for hearing aids. We don't call it a hearing aid program because it's not just about the ear. Our previous executive director, Sherry Collins, would always say, it's not about the ear, it's about the whole person. And so that's where the component of our HAP, HHAP, is oral rehabilitation, AURAL. So learning to hear, learning to use your devices, learning to communicate, learning about accessibility at movie theaters, how to advocate for yourself at court, all these kinds of things. All of that educational component is part of our Hearing Healthcare Assistance Project. So over 1,000 people have contacted Christy. She directs them to the best resource for them, depending upon their needs. This is a statewide program through our 3 state universities, Northern Arizona University, University of Arizona in Tucson, and ASU right here in the Valley where we're located. So I'm just really thrilled that we have this project going. I hope to develop it into a program. So it's been a demonstration project so far with a small amount of money and great cooperation with our state universities. 1.3 million Arizonans are hard of hearing, like me and Christy. And that's a range of hearing loss, from a mild hearing loss to a profound hearing loss. And my hearing is progressing. My hearing loss is progressing. So over time, I've had to adapt to more powerful hearing aids, hearing assistive technology, using captioning. And so I'm very, very invested in watching captioning, watching the quality of captioning, which again, our previous executive director, Sherry Collins, called me Caption Cop. She gave me this name sign of Caption Cop because I'd be like, those captions are not good, or that's not what they said, or I replayed it and that's not what I heard. So captioning is really important to us. Access to communication, access to hearing assistive technology, access to those signaling devices, the smoke alarms that Rena mentioned. She's doing great work with the smoke alarm walks and getting funding for those. So just really, really excited about what's happening in the program here. Looking down at my notes, make sure I cover everything. One of the things that the Hard of Hearing Task Force has done, and some of you have been on here, I think, from the beginning, is we've written several position papers that have been adopted by the board, and those are located on our website. Some of the position papers that I wanted to reference were regarding unlicensed providers of hearing healthcare services. This is something that we became aware of And so we brought it to the attention of the board, and they adopted it as an official position of the commission. Another thing that we talked about was the cost of hearing aids being so expensive. Again, we knew what a burden that was. So that was in 2013. So again, you see, we're talking about issues that are impacting the community statewide, the hard of hearing community of all ages. In 2013, in 2019, we finally start the Hearing Healthcare Systems Project. So it's an evolution of our agency over time. One of the things that we worked on back in 2009 was a shortage of CART providers. CART, C-A-R-T, Communication Access Real-Time Translation. We have, of course, here today, a professional, nationally certified professional captioner providing our captions, live streaming those to YouTube. And again, if you're watching on YouTube, I'll pause for change in interpreter. If you're watching on YouTube, the captions are just a little bit delayed as they stream live, but then if you watch the recording, they'll sync up. So we recently, one of our hard of hearing commissioners reps asked us to look into that issue again. So we do have a position paper from 2009 about CART providers, a shortage. We're looking into that issue again as well. So just a lot going on, but really thrilled to be here with you today. Just so glad to have spent 18 years now with the commission, doing what I love, growing the hard of hearing program to best meet the needs of 1.3 million Arizonans. So with that, I will close my camera and we can move on with the agenda. I know we have some time later for other discussion and announcements.
Thank you so much, Michelle. I just want to double check that I don't believe Cynthia's with us. I don't believe she joined at a time when I wasn't looking. I'm just going to double check my list. I know she was going to try to join us from out of state, but so we don't have the agenda item. Let's see, that's number 8 for Aloha today, but we'll hope that she can join us at our next meeting. So we will go ahead to the next agenda item, number 9, which is the HLA chapter leadership announcement. And I will have for HLA, Commissioner Fred Williams is the new president of the HLAA West chapter. And so, Fred, we would love to hear from you and just any updates on with the West Valley and how everybody's doing.
Good morning, everybody. With your permission, I'm going to make this kind of quick. First of all, I didn't know what was the sign for dinosaurs, so I'm glad we got past that. That's good. A lot of change where we are. We don't know where we're going to be meeting in October, so the first thing we have to do is form up our venue. The church we're in, the place we're meeting is not working for us. We're going to try to move back to our old room, but it needs hearing loop work and internet access, and they're working on it now, so we got to get that done. We also have a new board. We have a new vice president, Shannon Tyree, you probably know her, a new secretary, Fred DeWorth, who's a really great guy, very smart and very helpful, and he's helped us change. And we have this treasurer, Pat Williams, and we have the bonus of Melanie O'Rourke being a past president. So we have 5 people on our board right now, and we're trying to get our venue set and our next season and some of the basics that need to be done to have a good season. And we're looking forward to the convention. That's coming up pretty soon. And then we're looking forward to the Walk for Hearing. Ron will probably tell you about that. That's a big deal here. And those are the things we're doing right now. I'd be glad to take any questions, or you can email me. I'm glad to have answer.
Thank you. I want to make sure that I'm not muted. Thank you, Commissioner Williams. Appreciate that information. Does anybody have any other comments or questions for Fred regarding the HLA West Valley? Okay. All right, well, I will turn it over to Ron Tallman. And Ron, I know you're going to be sharing information on HLA East Valley, and then feel free to take us to the walk for hearing, the next agenda item after that. We're happy you're here.
All right, thanks. Thanks, Fred. Nice to hear what's going on out there in the West Valley. East Valley right now, we're on summer break, and we start meetings back up again in October 9th to be exact. We closed out the 2024-2025 season with a guest speaker from named Amanda Luker from the Association of Commuter Transportation state organization, and she discussed challenges traveling from a transportation expert point of view. It was very well received, and she was very, very, very well spoken. And a lot of fun. We're looking forward to starting back up. As I said in October, some ideas that we're looking for guest speakers is to have both the fire department and the police department to come out and talk to those of us who are hard of hearing. And we're going to meet in July to talk about other topics that we would like to have covered. HOPE will start up again on October 23rd. And just for some number-wise, on average, our attendance from the 2024-2025 season, we averaged 34 people in attendance. We had a high meeting of 49 and a low meeting of 29. So, in my opinion, I think the draw to bring individuals out to the chapter meetings is your guest speaker, and not so much the topic, but the delivery and the information being provided. So if any questions about our chapter, you can email me. The 10th annual Arizona Walk for Hearing will take place on 1 November this year. They'll be at the same place at Riverview Park, and the staging area will stay the same. The course route may change slightly, but I don't think it's going to be a big change where anybody's really going to notice it. It's just something I'm working with the city of Mesa about right now. I am also looking forward to the HLAA convention from the 11th to the 14th in Indianapolis. It's an opportunity to meet some friends and see old friends, make new friends. And they're gonna have doing things a little differently this year. A lot of changes were made to the Walk for Hearing accountability and management area. So I'm looking forward to they're going to do a little bit of education for us, and we can take what they have and bring it back and implement those changes coming up in November for our walk. So I will keep everybody informed as this moves forward. Like I said, I'm not 100% sure what all the changes are going to be, but there's going to be a few. And those people who are attending the walk may not even see these changes. So if you have any questions for me, you can email me or whatever, Facebook me. Thank you very much.
Thank you, Ron. We always look forward to the Walk for Hearing, and I'm looking forward to seeing you in Indianapolis too. Does anybody have any questions for Ron? Any comments? Okay. So our next agenda item is just any additional announcements. Does anybody have anything else that they would like to share or any questions? Please feel free to turn your camera on if you do. All right. I don't see anything additional, but at this time we will be, let's see, I'm going to, let's see here, just wanting, I will let everybody know and keep everybody posted as far as our date for our next meeting in August. I'm just waiting to get confirmation on when that will be, and I will send an email out to everyone and keep everyone posted on that. We always appreciate all of your, all of the work that you do and all of your feedback and participation in this meeting, and helps us to all stay connected and to get the word out. And, you know, if you ever have any suggestions for me, you know, anytime, feel free to send me information, email me, don't ever hesitate. All right, if no one has anything further, I'm going to go ahead. It is 10:56, and I can close out the meeting, adjourned for today, and we look forward to seeing you all next time, and appreciate all of your time. Thanks for being here, everyone, and I'll go ahead and close out.